We are the medical professionals. We are the first one to step in the front to help the society and help the situations. So that is our responsibility. My responsibility even higher. So that's why I would like to step to this particular front line in order to help the situations, and at the same time, I think that my knowledge will be helpful. I'm Ming from the City University of Hong Kong, and I'm also the assistant professor in public health and epidemiology at the Department of Infectious Disease and Public Health. For the medical research, my main focus is mainly for the gestational diabetes patients. So during the research, we are going to find out the best management plan for the patients in order to control the diabetic situations. For the public health policy research, I'm going to find out the best screening program for our patients in mainland China. So I went to United Kingdom and also United States for my postdoctoral training. So the first step, I go to UK for my postdoctoral training at the Oxford University. So that is a very good experience for me. And at that university, I can meet a lot of different researchers all over the world and learn how to do medical research. And after that, I went to Harvard University, another school which is the most prestigious in the world, and also meet a lot of different people and establish my own research fields. So that is the public health policy. In the past 10 years, I devote myself in the medical research, especially in clinical research as well as the public health research. And in the research projects, we are going to help the patient to find out the best treatment or management for them. And also for the public health preventions and also the policy research, we are going to fix the problems, for example, the prevention methods and also the screening program in mainland China. So that's why I would like to go back to China and to help our patient in the mainland. As you know that if you have these kinds of exposure, you will very easy to find a job in the overseas countries, especially in the United States, because you have the exposure in Harvard University, and also I got the master's degree at that. So for most of the people who ask me the same questions, why would you like to go back to mainland? My answer will be very simple, because it's the original idea that I study abroad. So for myself, the reason why I study abroad because I would like to learn something new and also would be helpful for my nation. So that's why at that time I would like to go back to my mother tongue. As a medical doctor, when we're facing a pandemic of a new diseases, especially something like the COVID-19, most of our citizens are very worried about that. We are the medical professionals. We are the first one to step in the front to help the society and help the situations. So that is our responsibility. As a teacher in the medical school, as well as a teacher in the preventive medicine major, my responsibility even higher. So that's why I would like to step to this particular front line in order to help the situations, and at the same time, I think that my knowledge will be helpful. Of course, most of the family members will worry about your situation because we are facing a new infectious disease with the unknown mortality rate. And at the beginning, all of us know about that, the mortality rate is very high. So that's why they are worried about that. But for myself, it's a kind of responsibility in the society to have someone to step in front of the society to help the situations. So I think I'm the person that's suitable to do that. I still remember in 2020, actually before the Lunar Year, our pandemic starts. At that time, every one of us are very worried about this disease, but no one knows how to prevent it. Especially in the social media, you always see the news, but without providing any different kinds of prevention method for you. So I think that every one of us would like to have some kinds of these informations, and in order to help ourselves to prevent the disease, as well as to help the society to prevent this disease. So at that time, I contacted two of my students in the class in order to let them to help me to establish the volunteer team. And after that, we announced the informations about the volunteer service and recruit the student into our team. And luckily, and within 24 hours, we have 100 students who are from Macau, Hong Kong, Taiwan, and also mainland to join our volunteer service. And they are from the different majors. For example, some of them from the clinical medicines, nursing, as well as the media. And different students have different talents, and finally we divide into different groups. We have 5 different teams. For example, we have a teams in order to release the information and to have the public health education with our audience. And the second team is going to make some videos in order to talk about how to prevent the disease. Also, we have another teams that provide the information how to do the exercise, the physical activities inside the home, because most of us at that time are in quarantine. So different students have different talents and serve the volunteer service team. And at that time, the most important information for me is we are all only have a small effort, but we add together, we can have a very high impact in the society. So we serve our society with the information and we get a lot of achievement on that. Yes, in my experience, actually, even in the South China and North China is so different, but also in different parts around the world. So for example, the Western country and the Eastern countries is so different. I think the most important thing is let our teenagers to understand more about our countries in terms of cultural differences, in terms of language, in terms of exposure in workspace or the study area, and in order to let them to understand more about the condition in our nation. I think that is very important, is the first step they need to do it. I think the second step is we have to extend our collaboration between the Hong Kong and mainland. For example, in the medical collaborations, in the past, we have a lot of limitation in the medical resources. For example, we lack of the outpatients service for our citizens. And also when we need to book, for example, an imaging service, we need to wait 2 years or even 3 years. So at that situation, I think that the collaboration between Hong Kong and mainland will be very helpful for the citizen to get a better healthcare service. I think the second things I can do as a medical professionals is going to link up different resources together, especially in the Greater Bay Area, in order to help our medical service to improve. I think it is a good start to involve the China University inside the list, because it is recognition of the development of the medical education in China. So actually, before the list, actually our university in mainland China get a lot of different achievement in the past many years. For example, most of our universities increased their ranking in the university ranking scale around the world. And also, most of our universities now more emphasis about the English medium education. For example, in my university, in Jinan University, so actually our bachelor degree are all in English. And most of our graduates, when they graduate from the university and go back to the hometown, for example, in Hong Kong, most of the graduates can pass the license examinations. So this is indicated the quality of the medical education improved dramatically in the past 10 years. Nowadays, we have a lot of opportunities for the teenagers to involve in different areas in Greater Bay Area, especially in the innovation technology, and also establish a startup company in mainland China. Also make use of different cities' advantage. You could do your business more efficiently and more smooth. For example, when you do some IT-related industry, I think Shenzhen is a good place. But if you want to build up a new or big machine, that maybe Dongguan or other cities will be the best area for you to establish your company. I think it's a great opportunity for us to study in mainland China, because we have a lot of opportunities to study different majors that Hong Kong do not have. And also, we can meet a lot of different people during your university studies. For example, for myself, I know a lot of different students, also my classmates, all over in the China area as well as the overseas. For this background, I can learn a lot of different cultures and also know about the situation in mainland China, which will be helpful for my career later on. So I think that study in mainland China is one of the best ways for our teenagers to understand more about our relations, our countries, and different regions in our countries. Every one of us will have the dream. But what is Chinese dream? What is the difference between the dreams and Chinese dream? I think the most important keyword is Chinese. Every one of us have some dreams, but if we get together to have one common goal, that is China dream. So that's why we have to work together as a teenager. We have to provide our professional service as well as our hard working in order to let our countries to have a new achievements. The major concept is get together. So I think that in the competition in different nations, we need a lot of different talents, and we hope that our teenagers can provide their talents to help our countries in order to win these competitions. So in the international cities, they have some requirements. For example, we have to check the talents all over the world. Not only our own citizens or local people or the citizens from mainland China. We need to attract different talents all over the world. So the infrastructures of Hong Kong is so well in the past many years. So that is attracting a lot of different talents to come to Hong Kong. And I think that we have to remain this advantage. The second one is, in order to improve the connections between Hong Kong and also the mainland China in terms of Greater Bay Area, I think that will be further improve our international status. I think some of the people will think about it is a challenge, but for myself, I think it's opportunities. Because in the past few years, we already have a lot of experience on how to deal with a new pandemics. So I think that these kinds of experience will be very helpful for us to prevent the next pandemic from other new infectious disease. So in this pandemic, we also can see the support from the countries is very important for us. So being a medical teacher is one of my dreams. So actually, I really like my job. And also, I go together with my students. So every time when I talk to my student, we just like a fan. When I see their growth, I think that is the most important things for me. Because when I see their achievement, I'm even happier than them. So in the past 10 years, I've had lots of different students who are going to go to the very good university after their graduation, for example, in the Cambridge University, Peking University, so on. And their achievement is my motivation to become a teacher in the universities. And in the past 10 years, I was the class advisor in the medical school, and that is a wonderful experience for myself when I work in mainland China. So I think the 25 years anniversary is one of the milestones to prove that one country and two systems is successful. In the past 25 years, our teenagers have more opportunities in different aspects. For example, in the professional educations, in the networking with the whole different people in China and also overseas. And also you can see that we are an international city, and in the past 25 years, our GDP is also growing a lot. And all these prove that one country, two systems is successful. And in the coming futures, I think that in the Greater Bay Area, we can have a lot of collaboration in medical resources, in medical collaborations. For example, we can make use of the medical resources in Greater Bay Area to help us to shorten the curing time for the medical service. And also, for our medical resources, we can also serve our citizens from Guangdong area, especially in the Greater Bay Area. We can share the talents in different specialties. I think that in the next 25 years, we will have more achievement in terms of medical collaborations.